All right, welcome back to the deep dive.
Good to be here.
Today, we're digging into a valuable stack of source material you shared with us, all focusing on a really important topic if you have pets, ehrlichiosis.
That's right. And this guide, well, it gives a really comprehensive look at this significant tick-borne disease. It's a great roadmap for us.
Absolutely. So our mission, like always here, is to go through this material together, pull out the most crucial bits of knowledge, those key takeaways.
Yeah, helping you get really informed without, getting lost in the weeds.
Exactly. And with tick season ramping up in lots of places, or let's be honest, being a year-round issue for some, understanding ehrlichiosis feels, well, incredibly relevant right now.
Definitely timely.
So let's jump right in, starting with the basics from the source material. What exactly is this disease?
Okay, so fundamentally, it's an infectious disease. It's spread by ticks.
Right.
The source tells us it's caused by bacteria, specifically from the Ehrlichia genus. It mainly affects dogs, that's where we see it most, but the material also points out we're seeing more evidence in cats, too.
Interesting. So cats aren't totally immune then?
Not entirely, though clinical disease seems rarer, and a key thing right off the bat, it can vary hugely, from super mild signs you might miss all the way to really severe life-threatening illness.
Wow, quite a range. You mentioned bacteria. The source gets specific, doesn't it? Which ones are the main players, especially for dogs?
Yeah, it highlights three main ones for dogs. The most common is Ehrlichia canis.
Okay.
That one causes canine monocytic ehrlichiosis, or CME. Then you've got Ehrlichia ewingi, right, which causes canine granulocytic ehrlichiosis, and also Ehrlichia schaffensis.
Schaffensis.
Yeah, that one's actually more known in humans, causing human ehrlichiosis, but it definitely could infect dogs too.
And for cats, you said it's less common, but are they the same bacteria?
Well, the material notes that those same species, E. canis, E. schaffensis, and E. ewingi, have been found in cats. So yeah, they seem susceptible, even if we don't see full-blown clinical illness as often as in dogs. Research is ongoing there.
Got it. So these specific bacteria are the bad guys. How do they actually get into a pet? It's not like catching a cold, right?
No, exactly. The source is crystal clear. It's primarily through the bite of an infected tick.
The tick bite itself.
Precisely. And it even names the main culprits, the vectors. For E. canis, that common one, the vector is the brown dog tick, Rhipicephalus sanguineus.
Brown dog tick.
Oh.
And for E. wingeri and E. schaffensis, it's usually the lone star tick, Amblyomma americanum.
Lone star tick. Different ticks for different strains, sort of.
Exactly. And while you definitely see more cases in warmer weather, peak tick season, the source points out something really important about that brown dog tick. It can actually live its entire life cycle indoors.
Indoors?
Yeah.
Though.
So unlike a lot of other ticks, this one can potentially transmit E. canis year-round, even if you're in a colder area, if it infests a house or a kennel. That really changes the game for prevention, doesn't it? Not just a walk-in-the-woods problem.
It certainly adds a layer, makes year-round vigilance important.
Okay, so understanding transmission. That leads us to how the disease actually develops inside the pet. The source mentions distinct stages. How does that work?
Yeah, this is really key to grasping ehrlichiosis. So after the tick bite introduces the bacteria, they invade specific white blood cells.
Okay.
Depending on the Ehrlichia type, it could be monocytes or granulocytes. Inside these cells, they multiply, forming these little clusters called morulae.
Morulae.
And from there, they spread through the blood and the lymph system, basically going systemic.
Right, throughout the body.
Exactly. And the source breaks down the progression into three general stages, which is super helpful.
Let's hear him.
Okay, first is the acute phase. This usually pops up maybe 1 to 3 weeks after the bite.
Pretty quick, then.
Relatively, yeah. During this time, the bacteria are really multiplying and spreading. Clinically, though, the signs can be pretty vague.
Like what?
Just things like lethargy, maybe a fever, not eating much anorexia. You might notice swollen lymph nodes, that's lymphadenopathy. And on blood tests, a very common finding is a low platelet count thrombocytopenia.
Platelets are for clotting, right?
Exactly, so that's a flag. The pet's immune system starts fighting back, but often the bacteria manage to stick around.
Okay, so that's the acute phase. What's next?
If the pet doesn't clear it then, it can move into the subclinical phase. And this one is, well, it's sneaky.
Sneaky how?
Because the pet often looks completely normal, no outward signs of being sick at all.
Wow.
But the bacteria are still there, kind of dormant inside the cells. This phase can last for months, maybe even years.
Years. Without symptoms?
Potentially, yes. The only clue might be ongoing odd things on blood work, especially that low platelet count if you happen to run tests.
So you wouldn't know unless you tested.
Pretty much. The source says some dogs might clear it on their own during this phase, but they're also at risk of eventually progressing to the really bad stage, the chronic phase. This is when severe illness develops. And the source lists some pretty concerning things here, like suppression of the bone marrow. That means the body can't make enough blood cells, red cells, white cells, platelets. That's called pancytopenia.
That sounds serious.
It is. It leads to major bleeding problems. You might see tiny pinpoint spots on the gums or skin, called petechiae, or larger bruises, ecchymoses, even serious nosebleeds, epistaxis.
Oh, wow.
Plus severe weight loss, organ problems. The source is blunt. The prognosis in this chronic stage is guarded to poor.
That distinction between the phases is huge. An owner could have a dog that seems perfectly fine in that subclinical stage.
Exactly.
But it's carrying this potential time bomb. It really drives home the need for regular vet visits and maybe routine blood work.
It really does, even when they seem healthy.
Okay, so moving from the how to the what are the signs we might actually see in our pets? Keeping in mind it varies.
Right. Depends on the stage and the specific Ehrlichia. For dogs, those common acute signs we mentioned are key. Fever, lethargy, not eating, weight loss.
The general feeling crummy signs.
Yeah, plus the swollen lymph nodes, maybe an enlarged spleen, pale gums from anemia, those bleeding spots or bruises, and the nosebleeds. Those are pretty common signals.
Anything more specific?
The source mentions a few. Joint pain and swelling polyarthritis that's particularly linked with EU and GI.
Ah, the granulocytic one.
Correct. You can also sometimes see neurological signs like stumbling ataxia or even seizures, and eye problems are possible too, like inflammation inside the eye, uveitis, or bleeding in the back of the eye, retinal hemorrhages.
Eyes too, it really gets around.
It can. And in those chronic cases, the source notes potential long-term fallout like kidney disease or inflammation of blood vessels, vasculitis.
Okay, and what about cats? You mentioned it's seen less, but what signs might pop up?
For cats, since it's less defined, the signs listed are generally more nonspecific. Fever, lethargy, weight loss, maybe anemia, low platelets again, swollen nodes, and eye signs are also mentioned.
So, similar but maybe harder to pin down.
Exactly. The source suggests it's likely underdiagnosed in cats, partly because the signs aren't unique, and maybe vets just don't think of it as quickly as they would in a dog from a tick area.
Makes sense. With such a wide range of signs, some overlapping with other illnesses, how does a vet actually confirm it's ehrlichiosis? What does the source say about diagnosis?
Diagnosis is definitely a puzzle piece process, according to the source. It involves combining a few things. The pet's history, huge emphasis on tick exposure, even if it wasn't recent.
Right, that subclinical phase.
Exactly. Then the clinical signs the vet is seeing right now. And finally, laboratory tests to nail it down.
What kind of lab tests?
Well, standard blood work is usually the first step. A complete blood count, or CBC. That low platelet count, thrombocytopenia, is really the hallmark finding. It's the most consistent abnormality. You might also see anemia or changes in white blood cells, sometimes low, sometimes high.
Okay.
A chemistry panel can show other clues like high protein levels, specifically globulins, low albumin, maybe elevated liver enzymes. And if the kidneys are involved, a urinalysis might pick up protein in the urine.
So general tests give clues, but you need something specific for Ehrlichia.
Precisely. The source describes several specific tests. There's serology, which detects antibodies the pet made against the bacteria.
Antibodies, so that means exposure.
Yes. The IFA, or indirect immunofluorescence assay, is often called the gold standard antibody test. A positive means exposure, but critically, it doesn't tell you if it's an active current infection or just a past one. The antibodies can stick around.
Ah, okay. That's an important distinction.
Very. Then there are the in-clinic screening tests, like the ELISA SNAP test. The IDEX SNAP 40X is a common one.
We use those at our clinic.
Right. They're super useful for quick screening for canis and EUNG antibodies, quick check for exposure. But again, a positive usually needs confirmation.
So what confirms an active infection?
That's where PCR testing comes in. PCR looks for the actual Ehrlichia DNA.
The bacteria's genetic material.
Exactly. It can confirm the bacteria are present now and often identify the specific species. The source notes it's most likely to be positive during that acute phase when the bacteria are circulating more actively in the blood.
Makes sense. Anything else?
One more thing mentioned is just looking at a blood smear under the microscope. Sometimes you can actually see those morulae, the clusters of bacteria, inside the white blood cells.
Really? You can see them?
You can, but the source cautions they're often hard to find, easily missed, so it's not reliable as a sole diagnostic method.
Wow, okay. So it's really about putting together the history, the signs, the general blood work, and then usually one or more of those specific tests, antibodies and PCR. It's quite the detective work.
It really is. No single magic bullet test for all situations.
All right, let's shift to treatment. If a diagnosis is made, what does the source material recommend? And, what's the outlook?
The good news here is that the source points to a very effective treatment. Doxycycline is the antibiotic of choice.
Doxycycline. Okay.
That's for both dogs and cats. The standard dose mentioned is 10 milligrams per kilogram of body weight, given by mouth, once a day, usually for 28 days, a full month.
A full month. That's quite a course.
It is, but it's generally needed to try and clear the organism effectively. And a really positive point the source makes. Pets often start feeling better very quickly once they start the doxycycline.
Oh, that's good to hear.
Yeah. Sometimes clinical improvement is seen within just 24 to 72 hours.
That's fast.
It can be quite dramatic, especially in the acute phase. Now, the source does add that chronic cases, the really severe ones, might need longer treatment, maybe even repeat courses.
Right, because it's more entrenched.
Exactly. And depending on how sick the pet is, supportive care might be vital too. Things like IV fluids if they're dehydrated, blood transfusions if anemia or bleeding is critical, or even drugs to suppress the immune system, like steroids, if there are significant immune-mediated complications happening.
So treat the bug, but also support the patient through the illness.
That's the approach. And one really interesting, maybe slightly sobering detail from the source. Even after successful treatment, when the pet seems fully recovered clinically, those antibody levels can stay high for months, even years.
So the test is positive.
The antibody test often does, yeah. And while the PCR test for DNA might become negative, the source suggests the organism might still persist, hiding out in tissues at very low levels.
Wow. So cured might be complicated.
It seems it can be. Clinically cured, yes, but maybe not always bacteriologically sterile, if that makes sense.
It does. A persistence idea is.
Yeah.
Yeah, interesting and a bit worrying. So what about the overall prognosis then? The outcome?
The source says it really varies, mostly depending on the stage when it's caught and treated.
Except
For acute and subclinical cases, the prognosis is generally good to excellent. They usually respond very well to doxycycline, and full clinical recovery is the norm.
that's reassuring.
It is. But for the chronic phase cases, especially if there's severe bone marrow suppression or significant organ damage, well, the prognosis is unfortunately much more guarded, even poor sometimes.
So catching it early is absolutely critical for the outcome.
Incredibly so. And one final point on outcome. The source notes that even pets that recover well can sometimes develop long-term immune-mediated problems down the road, possibly triggered by that initial Ehrlichia infection.
So the battle might be won, but the war leaves lingering effects sometimes.
That seems to be a possibility, yes.
Okay. All of this really hammers home how important early detection and treatment are, which naturally brings us to prevention, since the source mentioned there's no vaccine.
Right, no vaccine. That's huge.
How do we protect our pets? What does the source suggest?
Prevention is absolutely paramount, and the source boils it down to two main things: comprehensive tick control and regular surveillance.
Tick control, tick control, tick control.
Pretty much. It lists the most effective strategies. Number one is using good quality tick prevention products, topicals or orals.
Like the flea and tick meds vets recommend.
Exactly. The source actually specifically mentions the isoxazoline class of drugs, products containing things like fluorolane or ethoxylane as being highly effective. They kill ticks quickly, often before they can transmit the disease.
Okay, good to know there are effective options.
Definitely. Then there's environmental control. Keeping your yard tidy, reducing tick habitats, dealing with any indoor pest issues, especially if that brown dog tick is a concern in your area.
Makes sense. Attack the problem where the ticks live.
And, simple but vital, regular tick checks on your pet, especially after they've been outside in grassy or wooded areas, feeling them all over, checking in ears, between toes.
Gotta be thorough.
You do.
Yeah.
And if possible, avoiding known heavily tick-infested areas, particularly during peak seasons.
Right. And just to reiterate that key point.
No vaccine currently available for ehrlichiosis. That's a direct takeaway from the source. Prevention relies entirely on stopping those tick bites.
So it's all on us and the preventive products?
Pretty much. And because of that, and the potential for year-round risk we talked about, the source really stresses the importance of educating pet owners. Consistent year-round tick prevention is just vital.
That lack of a vaccine really does put the pressure on prevention. Now, the source also touched on something interesting, a link to human health. How does that work? Is it like, can we catch ehrlichiosis from our pets?
Yeah, that's a really important point the source clarifies, and it causes confusion sometimes. The answer is no, not directly.
Okay, phew.
You can't get ehrlichiosis just from petting or being around your infected dog or cat. They aren't contagious to humans in that way. But UT.
There's a but.
There's a but. Remember those specific bacteria? Ehrlichia chafiensis and Ehrlichia UNG.
The ones that can infect dogs and cats, but also cause human ehrlichiosis.
Exactly. Those two are zoonotic, meaning they can infect both animals and people.
So where's the link if the pet isn't directly infecting us?
The link is the tick, the vector.
Yeah.
Your pet can go outside, pick up a tick that's carrying, say, Ehrlichia chafiensis, and then bring that infected tick into your house, onto your sofa, into your bed.
Okay, I see where this is going.
That tick might then drop off your pet and later find and bite a person in the household. So the risk isn't from the pet's illness, it's from the pet acting as a transport vehicle for an infected tick that can bite both pets and people.
They're like little tick taxis, bringing the danger closer.
That's a perfect way to put it. They ferry the risk into our immediate environment.
That makes so much sense.
And because of that shared risk, the same tick potentially biting both species, the source points out that veterinarians really emphasize tick control not just for the pet's health, but as a public health measure too, protecting the whole family.
Right. It's not just about Fido. It's about everyone in the house.
Yeah.
Adds a whole other dimension to why tick prevention is so critical.
It really does.
Yeah.
So just to kind of wrap up the core findings from this deep dive into the source material.
Yeah, let's summarize.
It really paints ehrlichiosis, especially in dogs, as, significant and potentially very serious disease. It has this complex progression through stages.
Acute, subclinical, chronic.
Right. And getting that diagnosis promptly and starting treatment early are just crucial for a good outcome. Delays can really lead to those severe, difficult chronic problems. And with tick populations seemingly growing and spreading, it's an ongoing challenge. No easy answer sometimes.
Definitely sounds like it.
It also highlights, the vet's role in education and screening and the need for more research, particularly, as mentioned, in cats where things are still a bit murky.
Well, this has been incredibly illuminating, digging into this source material on ehrlichiosis. We've covered a lot, what causes it, those specific ticks spreading it.
The brown dog tick, the Lone Star.
The way it can develop through those three, often sneaky, stages. The huge range of signs in dogs and cats. How vets piece together the diagnosis.
Using history, signs, blood work, antibody tests, PCR.
The key doxycycline treatment. How prognosis depends so much on timing.
Yeah.
And maybe most importantly, those vital prevention steps focusing on tick control.
Yeah, this deep dive really underscores how everything's connected, doesn't it? Our pets' health, the environment they're in, ticks, and potentially even our own health. It's all linked, especially with these vector-borne diseases.
It really is all connected. And maybe one final thought to leave you with, pulling directly from what we just discussed in the source material. Given that right now there's no vaccine for this disease, and that even after treatment, the source suggests these bacteria might persist, might hide out in the body, what does that ongoing challenge really mean for how we approach our pets' long-term health?
That's a heavy question.
And maybe, how does it make us think differently about something as simple, as joyful, as just letting our dogs run and explore the outdoors?
Yeah.
Definitely something to mull over. Thank you again for providing the source material that let us take this deep dive today. We really hope this exploration helps you feel better armed with knowledge and maybe prompts a closer look at your own tick prevention strategies for your pets and maybe for yourself too.